We all live in the age of modern medicine and miracles. We've done the impossible. We've brought the dead back to life, we've made the paralyzed walk again, and we've even made diseases disappear. The World Health Organization states that we actually completely eradicated smallpox, one of the most devastating and deadly diseases known to man, in 1980. How did we eradicate this beastly disease? The answer is actually quite simple: vaccines. After extensive research and working in the medical field myself, surrounded by other healthcare professionals, today I'm going to share with you many reasons why vaccination is actually a very good thing, and I'm also going to debunk a common misconception about them. Despite eradicating one of the most deadly diseases known to man, some would say we were reverting to our old ways. We seem to be in this age of modern medicine and technology, yet people continue to die every year from not getting their shots. According to the National Foundation for Infectious Diseases, in the U.S., vaccine-preventable infections kill more people annually than HIV, AIDS, breast cancer, and traffic accidents do alone. This means that approximately 50,000 adults die each year from diseases that could have been prevented had they just gotten vaccinated. Further, in 2015, the World Health Organization reports that over 130,000 people died in the U.S. from measles, and the measles is a disease that is preventable with vaccination. So clearly there is still a common issue revolving about people getting vaccinated and being healthy. But why are people refusing vaccination and risking their lives if we have a solution? Well, there are a lot of common misconceptions out there that keep resurfacing that people buy into. And I'm going to talk about one of them I'm sure that you have all heard of, and if not, I'll explain it to you. It is that vaccinations cause autism. I too wanted to know why this myth circulated. So after my microbiology class this past spring, Professor Robbie Fisher actually explained it to me and the rest of the students in our class during one lecture, and I also did some research about it on my own through the College of Physicians of Philadelphia, and I'm going to share with you my findings and hopefully prove to you that that is a myth. In 1998, a doctor named Andrew Wakefield and 12 other researchers posted a research paper claiming that he found a link between the combination vaccine for measles, mumps, and rubella and autism. After this publication, it went viral. It was all over every news outlet, and it terrified parents to vaccinate their children. So of course, after this outbreak, over the next 12 years, this link was studied extensively. However, no reputable, relevant study ever confirmed Wakefield's findings. In fact, in 2004, news got out that Wakefield actually was paid by attorneys to falsify data so that they would win their case. This means that Wakefield, the leading scientist on this research, falsified his results on vaccine and autism so that he would get paid. He was even banned from practicing medicine in the United Kingdom because of this. Despite all of this, Andrew Wakefield was actually very successful because he started a myth that would never be lived down, and he cost the lives of thousands and still continues to cost the lives of thousands every year because of it. Despite these common misconceptions, vaccinations are actually very safe. The U.S. Department of Health and Human Services documents all the stages that vaccines must go through in order to be administered to the public. First, they're tested for many years in the lab, on animals, in petri dishes, anything you can imagine, and that takes many years. After that, they go to clinical trials where it's only tested in a select few of the population. And in clinical trials, the FDA and the CDC work very closely together to determine if the vaccination is safe, what dosage is the best, and exactly how the immune system reacts to it. So through this, they're trying to determine even if it's safe to go into the public. If and only if it passes these clinical trials, then the vaccine goes to the public. But even when it goes to the public, every single batch that's ever made is tested for quality and safety, and is still extremely closely monitored once it's been administered into the public. Vaccinations are so closely tested and monitored that it takes many years for them to even get on the market. So if you're doubting vaccination safety, don't be. They're actually extremely safe. Not only are vaccinations safe, they're also crucial to everyone's health. The CDC states that we are all at risk for serious diseases that could have been prevented by vaccination. Not only do vaccinations protect you, but they protect those around you. And they also protect those who can't necessarily protect themselves. Believe it or not, we live in a world with many immunocompromised people. This means that their own personal immune systems are weakened, and they have to rely on other means, not their own bodies, to stay safe and healthy. This means they have to rely on others around them to stay vaccinated in order for them to stay protected. There are also people that are simply unable to build immunity, even if they would like to. I'm actually an example of this. I have gotten the chickenpox vaccination over 5 times now, and yet every time they test my blood for immunity, it's not there. I guess my body is just incapable of making antibodies against chickenpox. This means for me that I have to rely on others around me to stay vaccinated and stay healthy, because if they get sick, I'm gonna get sick. And I work in the emergency room where disease is rampant. So it's very important, especially for my health, that other people stay vaccinated and up to date on their shots so that I stay healthy. In conclusion, today I have talked to you about the importance of vaccination and hopefully shown you that it's very safe and it's actually really important for everyone's health. I hope you also choose not to believe all of the myths that circulate around about vaccinations. Vaccines are not just for you. They're for the health of your future kids, for others around you, and people who could not necessarily protect themselves, like me. I hope you all learned their importance, and I hope you will vaccinate yourself and your families in the future. Thank you.